You're looking at the big picture with Edwin Eisentrath on WCPT 820.
Okay, everybody. I am thrilled, really, to be joined by Elizabeth Jacobs. She is a hero. She's an epidemiologist and, I guess, professor emerita at the University of Arizona. She's the founding member of Defend Public Health, and we're going to talk about that. And I guess to understand that, we're also going to have to talk about the undefending of public health from Make America Healthy Again. Elizabeth, welcome. Thank you for being with me.
Thank you so much for having me and for this overly kind introduction. I really appreciate it.
No, honestly, I think yesterday we might have seen some of your work actually make a difference, although it's so chaotic we can't tell. But let's unpack all of that. In this past week, both HHS Secretary Bobby Kennedy and fired CDC Director Susan Monarez testified before Congress. They didn't say the same things. I'd like your thoughts about that. But, should we start there? Let's start there, and then let's end up with the set of meetings that just happened and the whole fight with whatever this Maha movement is.
Sure. And I just wanted to start by saying everybody has to make a decision when it came to Dr. Monarez and Mr. Kennedy as to who they believe about what happened in regard to Dr. Monarez being fired. I personally agree or believe her 100%, and I do not believe what Mr. Kennedy had to say about it. Dr. Monarez was put in front of a Senate hearing. She did not back down. She did not change her story. She sat there with steely calm and was not rattled, which to me is a very strong indication that she was telling the truth, that Mr. Kennedy was asking her to do things that are unethical for a legitimate scientist to do, such as sign off on policy in the absence of seeing the data first. So I definitely think that Dr. Monarez's story is the truth.
During that hearing, one of the Republicans shamefully lied and said, "Are you sure? Are you sure you remember that? We have a recording. Are you sure? Because I'll play that recording. Are you sure? They're under oath. Are you sure?" And she said, "Yes, sir, I'm sure." And it turns out he was lying and there is no recording.
That was absolutely shocking and disgraceful. And again, that's another reason why I believe that Dr. Monarez is telling the truth. He was bullying her. He was verbally abusing her, calling her a liar. And she just looked at him and said, I'm telling the truth, and so you can pretend there's a recording or not, but it's not going to change my story because I'm telling the truth.
Yeah, and I thought she was awesome. Yep. Awesome.
Totally.
All right.
Hero.
But fundamentally, the difference between her testimony and Secretary Kennedy's, the core of it was on this question of was he saying, I'm looking for people who will lead the CDC, who will okay things that the science doesn't support. And she said she wouldn't do it, and that's why she wasn't there. He said, "Oh, that's not right. That's just not right." And it's clear he's lying.
Absolutely. And even just think about it. If somebody asks you, are you a trustworthy person, who is going to answer no? I was completely incredulous when I heard that. And then, again, Dr. Monarez, her appearance at the Senate hearing absolutely confirmed beyond a shadow of any doubt that she was the one who was telling the truth.
I have to say, knowing that she was, in fact, appointed during the Trump administration, surprised at how remarkably data-focused, honest, and how much integrity she had.
Absolutely. And I think that if the American public had a chance to meet CDC staff and scientists, they would see that she is not the exception. Although she is an exceptional human, in my opinion, that is how CDC employees are. They are scientists and staff members who have a vested interest and a passion for trying to improve the health of Americans, to keep people safe. And so I think she was just emblematic of what CDC is actually all about. And I think a lot of the doubt that has been cast on CDC employees, like Kennedy telling them they're horrible people, is just frankly disgusting, and is a really strong indicator that he has never sat down and talked to any of these people. He has no idea what they're about.
Yeah, so the CDC's had a lot of critiques probably since COVID or during COVID, but it is, any organization can make mistakes, but it is in this era that we live in, where there are a lot of people on this planet and pathogens are jumping from one species to the next, and they're truly public health challenges like we've never seen. They are like NASA was in the 1960s, the most scientifically adept, interesting, hardworking organization in the government, or they were until this wrecking ball hit it.
Yes, and it is really alarming the degree to which political appointees are sort of metastasizing throughout the CDC and, frankly, throughout all of the scientific wings of the United States government. It is alarming. The person who's the interim director of the CDC right now has zero training or experience in science or healthcare, and so he's a functionary. He's a factotum that is there to sign off on whatever Mr. Kennedy wants.
Yeah, appalling. Absolutely appalling. All right, so I read a piece you authored back in July that talked about all the ways the Trump administration was going to make us less healthy. And that was July, and it's now mid-September. And it sure looks like you didn't go far enough. So, just back up and talk about the lines of attack on public health in America.
Sure. So right now there are four main arcs, in my opinion. One is that the Trump administration, this is not confined to Mr. Kennedy, is spreading scientific misinformation. They're sowing mistrust in public health at every turn. The second one is that they're casting doubt on the scientific process itself. And science is a process. As we get new information, do new experiments or studies, we have to modify our knowledge and react to that. And he casts doubt on that regularly. And he also is casting doubt on scientific expertise. He's telling people that it's not democratic to listen to experts, which is just completely Looney Tunes. We all know this. We don't call our hairdresser or our barber when we need our sink fixed. We call an expert. So that's the second piece. The third is the massive firings that have gone on at NIH, CDC, FDA, EPA, all these really important science-based institutions, and making draconian cuts to their funding, which probably is them going to lead to them saying, look, these places never functioned anyway. Well, you can't function when you fired support staff or you fired the communications folks, because then the public really doesn't know what's going on. And then finally, a big piece is that they are definitely undermining our U.S. vaccination system. So those are four main areas of attack that are coming from the administration right now.
Yeah, I don't understand why they're doing it. I just don't. I asked Representative Sean Casten, who was on just before you, and he's a scientist before he came to Congress, if he thought this administration was just, whether in HHS or over at the EPA, whether they're just replacing science with ideology. He said yes. but I guess I wasn't quick enough or smart enough to ask, like, what ideology? Because I don't understand why it's in anybody's benefit to make America less healthy.
Oh, I agree. And this is a question for the ages, and it's interesting to see the many, many interpretations that different people have. I will say that, yes, they are replacing science with ideology, and it's just this insidious process that's happening incrementally in some cases and suddenly in others. And I believe one of the driving things behind it is, frankly, revenge, because the pandemic proved a number of these people to be just completely out of touch with reality. They didn't like Dr. Fauci, for example, who was doing his best in a horrible situation to get accurate information out, and that often contradicted Mr. Trump. And so he, I think, literally has a vengeful streak against all of government science, and I think that's driving part of it. For Kennedy, he has been at this scientific misinformation dealio for 2 decades now, and legitimate scientists would never listen to him. And now he's in a position of influence and power, and he's using it to just wreak complete havoc on scientists.
Well, so I don't want to go too much into all of the kinds of meetings that happened this week, only because the initials, the acronyms are confusing for those of us who aren't deep in that world. But they were important meetings that decide the future of vaccines in the country, right? Who gets what, whether insurance will pay for it, what's required. And I saw, I think because you helped me find it online, not you and your social media helped me find it, a presentation that went on at that meeting, which had almost nothing to do with actual science. I mean, like, how is it that through the staff, that in front of the commissioners of these organizations, they have to watch just propaganda?
Right. And so I think that I'll just briefly explain for the audience that it's the Advisory Committee on Immunization Practices, which I will now refer to as ACIP. And this is a group of people whose recommendations are really critically important because they decide their recommendations result in insurance, public and private insurance, being required to cover certain vaccinations. So if they recommend it, then insurance has to cover it. And it impacts the availability and accessibility of vaccines. So in the past, these meetings have frankly been boring as heck, and nobody really wants to tune into them. But now it's turned into just this disgraceful and shameful display from the members of this committee. The reason is that Mr. Kennedy fired all of the prior scientists who had experience in public health and in healthcare, and he replaced them with people that he handpicked because they have previously displayed anti-vaccine beliefs. What that resulted in is this contrast between career CDC employees who are still working on science. They're legitimate experts. They're presenting information. But the committee itself, the people who vote, were just like, I called it a goat rodeo. I'm sorry, but the questions they were asking were completely inappropriate. They were badgering the CDC scientists. One of them was just posting on Twitter during the entire meeting about whatever, and it was just a disgrace. And they also had a number of people present misinformation. Should have never been allowed. It was disgraceful.
Disgraceful, really disgraceful. All right, let's talk about the organization that you helped found, Defend Public Health. Describe what it is, and I guess then let's go talk about Make America Healthy Again and what that is.
Absolutely. So Defend Public Health was started right after the 2024 election. It's an advocacy group. It's made up of scientists, healthcare professionals, and other advocates. And our goals are to provide accurate information to the public when there is so much misinformation, and to organize and implement change where we can in the face of attacks on public health and on science.
Right, and it's volunteers, it's people who have expertise, and you have these committees and you do these reports that are public. I think it's a great resource.
Oh, thank you. Yes. I mean, we are trying to provide reports that counter the major things that come out from Kennedy's shop. I mean, we can't possibly address all of it, but we are doing our best to address the major flaws with MAHA. I don't know whether you want to get into that yet or not, but that is one of the purposes of our reports.
Well, let's get into it. Talk about it.
Okay, so MAHA, or Make America Healthy Again, is Kennedy's whole baby, I guess. And the entire premise, first of all, of MAHA is flawed because, frankly, America has never been healthy for everybody. So to make it healthy again is, again, a flawed premise. So I'll give you an example. Kennedy is always talking about how things were better in the 1960s and people were healthier. But first of all, for people of color and other communities with sometimes fewer resources, there were massive health disparities. And they've improved a little bit, but we do still have a problem. And then if we just look at the quote-unquote health of Americans overall in the 60s, yes, there was less obesity, but that is the only thing that Kennedy focuses on. He ignores things like 42% of adults smoked in the 1960s, and it's only about 11% now. Our lifespan is about 7 years longer. The infant mortality rate has dropped substantially since then, of course, and largely due to vaccines. So
right.
MAHA's premise is flawed from the get-go. And then another major problem is that
you're only going back 10 years. Hang on, you're only going back 10 years. You know, I mean, in the 1930s and 40s, there was polio.
Oh, sure.
We weren't healthier then. But kids would miss months of school because they were quarantined with scarlet fever and, you know, things that people don't even think about anymore that are going to all come back.
Absolutely. And I'm actually glad that you brought that up, because that is one aspect of vaccination that has been largely ignored. Of course, the primary goal is to prevent people from getting sick, but there are massive economic consequences to infectious disease outbreaks that could be prevented by vaccines. Two of the major ones are every case of measles costs $20,000 to $30,000 for public health efforts to contact trace and to treat the patients and things like that. But the other piece is that if your child becomes ill with measles, they need to stay home from school, and that often means that a parent has to stay out of work. And so there are massive economic consequences to this.
All right. Well, I interrupted you with that, and you were continuing to talk about some of the MAHA narrative.
Well, sure. I just wanted to point out, too, that MAHA is often at odds with what's actually happening in the Trump administration. So, for example, MAHA puts a lot of emphasis on healthier diets, but at the same time, the Trump administration is cutting SNAP, so families have less money to buy food. Food banks are seeing increased demand and in some cases less funding. Mass deportation is leaving crops unharvested, and the U.S. actually already imports 60% of its fresh fruit and 30 to 40% of its fresh vegetables from other countries. And of course, with our, I guess, declining relationships with our trading partners, that is a concern that I think we should be talking about a little bit more. So another major piece is access to health care. If you really want people to be healthier, they must have access to health care. And there is a massive problem coming at the end of 2025 when supplements to the Affordable Care Act are going to expire. And that's going to lead to people's health care costs, in some cases, rising by 75%. That is not going to help Americans be healthy.
No, and that was the issue in passing continuing funding bill in the government, and the Republicans said, we're not doing it. We will not move on this issue. We believe we should let them expire. We can't afford to keep America healthy, they said, as if a sick America is better for our economy, as you pointed out. Hey, in Florida, they said, we're not going to require any vaccines for school anymore. And they on top of being stupid, they pitch this as an individual liberty question. And forgive me, I'm going to be a little gross here. I think it's, for public health, it's the same thing as saying, you know what, it is my choice not to use the municipal sewer system. I am just going to go right on the edge of my property at my neighbor's property, and everybody can get cholera.
Yeah. Actually, you're really not far off on that. And, I guess those are the days when America was healthy in Kennedy's eyes. But this thing going on in Florida, it's going to spread to other Republican-led states. And I just really want to point out that, perhaps this is a failure in public health communication, but the importance of herd immunity is so great that vaccination programs really aren't very effective without it. And so vaccines, there are infants too young to be vaccinated against some diseases, and they're protected by a bubble of people around them that are all vaccinated. So they can't really encounter an infectious disease in that vulnerable period. When those rates of vaccination start declining, then holes in the bubble start to appear, and the risk of an unvaccinated infant, for example, catching one of these diseases is just incredibly increased. And so I am fearful of what is going to happen in Florida. And of course, there is no barrier at the state line. It will then spread throughout the United States, just as we're seeing now with measles.
Yeah, so that's one problem, and that problem of those bubbles is going to lead to parents having to watch their children die. And it's unbelievably shocking that that's where they want to go, back to where we were before when, people had 5 and 6 kids because 2 or 3 of them might survive to adulthood. And they want to go back to that. I don't know that's a good idea. The other issue, I think, and correct me if I'm wrong, is that if we lead a lot of people not to get vaccinated, you create a reservoir for these viruses to mutate, to grow, to become something new and more dangerous.
Yeah, that absolutely can happen if we are seeing a large mix of vaccinated and unvaccinated. It's like a Russian roulette or a lottery system for pathogens that they can mutate, and they can mutate to avoid or evade a vaccine eventually. It does take a lot of mutations for that to happen, but it is a possibility. And again, you can't predict which mutation is going to happen when, so it could happen at any time, and that would be a complete disaster.
Yeah. So when someone opts not to get vaccinated, not to get their kids vaccinated, it isn't just a private decision. It puts everyone at risk.
That's absolutely right. And in fact, there was a Supreme Court decision, Jacobson versus Massachusetts, that addresses exactly that and says that the safety of the community is more important than the safety, or than the preference, I should say, of the individual.
Sure. Let's see if the Supreme Court, when somebody comes in and says, but God told me not to get a vaccine, and now it's a question of religious freedom, what the Supreme Court will do.
Yes. And I, too, fear the outcome of that.
Yeah. Well, all right. How do people help us do this fight?
So I think that one really tangible thing is to, we just talked about Florida, to really pay attention to what your state is doing around vaccines. Vaccines are actually really popular among both sides of the aisle. Many Republicans support vaccination, and you may not be aware of that based on some of the things that you see, but it is true. And so I think if your state is moving to undermine vaccinations, because it is local, you could have the most power in appearing at hearings and writing to your local representatives to sort of defend vaccinations, because I think that might have the most visible results.
Did I lose you?
No, I'm here.
Okay. Sorry about that. I lost you for a second. So all right. And if they live in a state where their government is doing right by vaccines, what can they do?
Well, I think that they should definitely get their children vaccinated and just keep monitoring. But I think the other thing that they should do is be very wary of misinformation online. A lot of misinformation makes people really angry, and so they want to respond to it or debunk it, and that way they end up spreading it. So two things, just really pay attention to what you're reading. Look at it with skepticism, everything, even the things that I write. Ask yourself, is this true? Where are the data? Did she provide a link? We should be doing that to everybody and be very careful about not spreading information.
Yeah, but listen, everybody, go to Elizabeth's organization's web, Defend Public Health. There are reports there. You don't have to be a scientist to read them. But the data, you can find it. It's a very good resource.
Thank you very much. And yes, specifically, we have our report on improving the health of Americans. We have a report about the scientific evidence for contributors to autism. And then we have a report about how we know that COVID-19 vaccines did not cause the death of children. So those are three that we have right now. And I would love it if you all came in and visited it.
Please, everybody, share them, because just the nonsense is dangerous. It leads people to make stupid, dangerous decisions and harm us all. And this is good defense. Hey, thank you so much for your time today and for the work, incredible work, and the dedication to the work that you're bringing.
Well, thank you so much for having me. I really appreciated this opportunity. So thanks.
We'll do it again, in a month or so as we see how this is shaking out. Thank you.
Thank you. I would love that.